The province pumping much-needed funds into our healthcare system while Albertans wait to see how hard the variants will hit the province. Good evening, I'm Tara Overholt. All of this comes and many businesses count down the days until some restrictions are relaxed. And as Alberta heads into the 11th month of the global pandemic, Premier Jason Kenney announcing $68.5 million for long-term and continuing care operations and other healthcare facilities.
This one-time funding will help cover the costs that operators have faced as they've worked to protect vulnerable Albertans. This includes additional cleaning, personal protective equipment and related supplies, and increased staffing levels.
The bulk of that money, $48 million, goes to private supported living facilities, with $10 million each for addiction and mental health treatment facilities and home care. The last $1 million goes to hospice care. Kenney says this is on top of the $260 million already invested by the province since the pandemic began. Kenney says the plan on how to allocate over $300 million from Ottawa will come soon. Meanwhile, concerns over the new variants in Alberta doesn't faze Kenney when it comes to the lifting of measures Monday. He says it's a gradual approach based on hospitalizations.
We've also massively expanded our contact tracing system, so we're able to get on top of cases like this much more quickly. Secondly, I think the new federal travel guidelines and restrictions with respect to pre-testing, testing upon arrival, and the enhanced quarantine measures should all help to reduce the future introduction of these viral variants into Alberta.
As for restaurants and churches who have flagrantly violated the public health orders and not been harshly punished,
I don't want to live in a society where politicians are pointing fingers at who should get penalized and how. That's not how our democratic system works.
He says it's up to the local agencies to use the tools available to them to enforce the rules.